Eric Fry here, and joined once again by Dr. Jennings from HSHS St. Anthony Memorial Hospital. Good morning, Doctor. How are you?
Hey, good morning. Baking in the sunshine.
Hey, take advantage of it. It may not be here for very long. I saw the weather for the possible weekend rain, so...
Yeah, a little bit, but you know what? That makes those flowers bloom, and that makes my eyes water. Which are all good signs of spring.
That's right. It sure is. Now, we're here to talk about vaccinations. And I know you've probably had a lot of people come and ask you questions about vaccination. So I'll just let you kind of take the floor here, Doctor, and talk about the vaccinations and how we're doing in our progress and some questions you may have heard from members of the community.
No, absolutely. Hey, I appreciate the opportunity, and I've got great news up front. That is that our percentage of vaccine rates continues to climb. As we looked at the Restore Illinois plan when we spoke last time, really the first step to getting to the bridge was getting that population over the age of 65 greater than 70% vaccinated,
Correct.
And we're actually at 76%. So
awesome.
We've hit that threshold, which is extremely exciting. And then getting all the way to Phase 5, we have to get 50% of folks greater than the age of 16 vaccinated, and that's actually all the way up to 47%. So those numbers, as far as the percent vaccinated, looks extremely good.
Good.
Unfortunately, what we're seeing, though, is the rise of the variants running around amongst our different populations across Illinois, because remember, in this scenario, Illinois has to kind of go in step together, not as separate regions. And with the rise in variants, and even locally, we've seen an increase in the number of variants, and our hospital bed utilization has gone up, our number of test positivity has gone up, our ICU bed availability is going down. So those are all working against us right now. I think the most interesting thing that we've seen across at least my health system as we look at the data, during the peak of COVID, kind of the first big phase of it, and then subsequently in November, December, the average age of the hospitalized patient was around 75. And now we're seeing that drift down by about 15 years. The average age of the patient's now about 60 to 65, which to me says that talks about the idea that older population, that seasoned population over the age of 65 has gotten their vaccines. And so we're not seeing as much disease in that population, and so we're seeing it in the younger population, and yet they're still ending up in the hospital. Fortunately, the mortality rate has stayed okay, but that probably just reflects the fact, again, that you got a younger population that's being affected, and they're in better health when they acquire the disease. But certainly it's still leading to hospitalizations, and the experience that we've had with this disease of how ill and how long people stay ill, I still think that's the unique thing as I practice in it, when I work, because when I'm CMO, I'm not actually working, but when I work as a doctor, it's striking to me how long some of these folks stay ill, and it takes weeks for them to recover. So, even the younger folks take a long time to recover. So the vaccine has clearly got a beneficial role, and needs to hopefully hit that younger population so that then we can finally hit those thresholds that are going to get us there. And of course, the hot spot in the media right now, and appropriately so, is concerns about the J&J vaccine and the pause that's been put on the administration of that vaccine. As this first rolled out, you recall that there was a lot of discussion about the new technology involved in the Moderna and the Pfizer vaccines, and questions about its safety. That's actually borne out to be an incredibly safe technology. And of course, as we I think spoke probably 10 months ago at this point, but about a long time ago, about the fact that a lot of that was actually developed during Zika and was already, some technology that we were on, which is what helped us to launch those vaccines much faster. That technology seems to have borne out and been extremely safe and extremely effective. The J&J vaccine is more of a traditional vaccine, and it actually had a lower efficacy rate out of the gate, so that 60, 65%, maybe 70% effective at preventing the disease, but still very, very high rates, almost 95% and up, of preventing hospitalization and death. So still an incredibly effective vaccine. Unfortunately, there's been a half a dozen or so cases of a very rare thing that can happen just naturally. I mean, we do see what they're describing with the J&J vaccine just in relation to other diseases, other viruses. I mean, this is not something that is clearly exclusively related to the J&J vaccine, but now that's the FDA and the CDC coming together to try to decide, is the likelihood of that higher than what you would expect just naturally to happen? And so there really is a tie to the vaccine. And if there is, then is it a certain predisposition within that population that's creating it, and the vaccine is otherwise extremely safe? Now, I will say that the complication is still much, much lower likelihood of occurring than your likelihood of dying of COVID. So the risk-benefit to the vaccine is still there. I mean, even with this possibility, the vaccine is still more likely to save you from death than cause any complication. But we're a country, especially, that we want things and we want it vetted down completely. And so I think taking the pause is the right thing to do. To spend a few days to sort it through, but I don't think that by any means discredits the whole idea of the vaccine process. And honestly, I think it at some level talks about why some of the technology that's being incorporated into newer vaccines in the long run may be a safer mechanism. But it'll play out on the stage of the CDC and the FDA as we kind of work our way through what that really looks like.
Now, Dr. Jennings, I got to ask you, if you have gotten the J&J vaccine, if you notice any changes in health, contact a health professional immediately?
You should, although I will say this disease that specifically what they're seeing, where these people develop blood clots in unusual places and at the same time have bleeding problems at the same time, it's a very rare thing.
Right.
It isn't subtle. This wouldn't be something that you're sitting at home going, well, I wonder if I've got this.
Right.
You'll know you've got a problem. This is the kind of thing that you will be coming to the emergency department because you're very, very ill. And so I don't think there's any. It's not subtle enough that you have to sit at home going, gosh, I wonder if I have this complication. This is the type of thing that even when it's caused by something, even when it's caused naturally from we actually don't know most of the time what causes it, but if it's caused by some other virus, which is part of the speculation of where it originates normally, you would be sick enough you'd be in the emergency room. You wouldn't be wondering if you were sick.
Now, one thing I know a lot of people I've talked to just on the streets and whatnot are talking about how, hey, I went and got my vaccine, my first dose, I can now go out shopping, don't need a mask, don't need a social distance, I am good, I can't get it. Is that's not right, is it?
Well, first of all, you can always go shopping because we want you to support our businesses.
Yes.
Coming off of Chamber Days yesterday, I want you to support our businesses. But first dose efficacy is around 75-80%. So even for the two-step Pfizer and Moderna vaccines, there is a lot of efficacy out of that first dose. That takes a couple weeks to develop. Then after the second dose, they're both 95+% effective, but then that's a couple weeks after the dose. But the big issue still is the ability to potentially acquire some of the variants that we want to continue to blunt that. And so unfortunately the masks at this point still shouldn't go away. We still should be respectful of social distancing. Certainly there are folks that for whatever reason have not been able to be vaccinated, and we don't want to put those folks at risk either. So the vaccine at this point is by no means a ticket to not having to mask and not having to continue to be respectful of each other and keeping each other safe so that we don't continue to spread. And although the vaccines at this point seem to have pretty good efficacy for the variants that are circulating locally, I mean, they seem to be effective. Some of the other variants that certainly may appear eventually within the region and have been in Illinois do not have very good efficacy with the existing vaccines. So, let's cut this off before it starts.
And if people have questions about vaccines or anything related to COVID, who should they reach out to?
We're always happy to provide information through the hospital, but the Illinois Department of Public Health website is robust. There is just unbelievable amounts of information there. Of course, the CDC's website, our local health departments, every time I'm on here, I always want to give them a shout out because, these vaccine clinics and drive-thrus and, just the man-hours that have gone into doing something so monumental in such a short period of time is just unprecedented in our history. So I just can't thank them enough. And I wouldn't directly contact the local health department because they're busy doing this other stuff. but the websites really are incredibly robust. And so please take a look at that. And, if there's something that can't be answered, I'm always willing to help folks out if they shoot something over the hospital. So.
All right, Dr. Jennings, thank you so much for joining me. Always a pleasure to talk to you, and we will talk to you again soon, okay?
Hey, thank you, and thank you to Cromwell for getting us on.